Today we're going to be talking about breath timing during exercise, and specifically with lifting. Everybody knows you're not supposed to hold your breath when you're lifting up something heavy, but if it's that obvious, then why do we still want to do it? Well, there is a scientific reason for it. The act of holding your breath during heavy exertion actually has a name, and it's called the Valsalva maneuver. Technically, the Valsalva maneuver isn't holding your breath at all. It's forced exhalation against a closed airway. The reason that we naturally want to do this is because when we force exhalation against an airway that won't allow it, we're increasing intra-abdominal pressure, the pressure in our abs. What this does is lock down the stability muscles so that the bigger, higher force producing muscles can do their work without being held back by the smaller, less force producing muscles around it. So biologically, the Valsalva maneuver actually does increase force production. However, just because it's natural for us to do doesn't mean it's a good idea or something that we should get in the habit of doing. The problem, as many people know, when you are holding your breath or forcing exhalation against an airway that won't actually allow the air out, is the toll that it takes on your cardiovascular system. The Valsalva maneuver is actually a diagnostic test used in cardiology and neurology. And the reason it's used is because it stresses those structures. We're not really going to talk about exactly how it's used for diagnostic testing because that's not really the goal of this channel. We're going to focus on the Valsalva maneuver's implications in the exercise physiology landscape. The Valsalva maneuver causes a rapid spike in your blood pressure and a decrease in the oxygen that's getting to your brain. That's why you hear in extreme cases if somebody is a power lifter and they're going for a personal record, occasionally people will actually pass out when they're lifting really heavy weights because they're doing this. They're doing the Valsalva maneuver. Like I said, it has been shown to actually increase force production, but it puts you at risk for these sorts of things. The oxygen isn't getting to the brain. There's a rise in your blood pressure at the same time. This is going to put you at risk of passing out. Now, passing out really would be the lower end consequence of what happens when you do the Valsalva maneuver. If you have underlying risk factors for cardiovascular disease or stroke and you're doing this Valsalva maneuver frequently enough or with a high enough load, you're putting yourself at risk for these cardiovascular or stroke symptoms to bring themselves to the surface. You're putting yourself at risk of a brain hemorrhage, which is a stroke. You're putting yourself at risk of a heart attack. Now, obviously, these are extreme examples. It's unlikely that you're going to have a stroke or a heart attack if you perform the Valsalva maneuver. If it was likely that it would happen, they wouldn't be doing it as a diagnostic test. But it just stands to show that if you have these underlying health conditions or a family history of these health conditions, you need to be even more conscientious of making sure that you're breathing properly during exercise. That gets us back to the actual title of this video. How are we supposed to breathe during exercise? Well, it's really very simple, and there's one rule that can apply for almost any type of resistance training. You should be breathing in during the eccentric portion or the lowering portion of a movement and breathing out during the concentric portion or the actual force producing, moving the weight portion of the movement. So for instance, this is going to look slightly different for different exercises depending on when the eccentric portion of the movement occurs and when the concentric portion of the movement occurs. For something like a squat, let's use a back squat with a barbell as an example. The eccentric portion occurs first after you unrack the weight. You're going down, you're controlling gravity's descent of the weight. That's the eccentric portion. That's when you want to be breathing in. Then when you're using as much force as possible to get that weight out of the squat position and back up against gravity, that's when you want to be forcing that air out. This is going to ensure that you keep a normal blood pressure and normal oxygen delivery while also maximizing the amount of force production. For an exercise such as a deadlift where the weight starts on the ground, you're starting with the concentric portion. You're starting moving the weight against gravity, exerting that force. You're going to want to take a big breath in before the rep starts. You're going to want to exhale while you're lifting the weight, and then you're going to want to inhale as you're helping control the weight down. So the rule stays exactly the same, whether the eccentric or the concentric portion occurs first. It's just a matter of understanding which is which, understanding what concentric versus eccentric is in an exercise. I know when I was in physical therapy school, that's something that can be difficult to wrap your mind around at first, but the more you do it, the less you have to think about it. Eccentric is always when you're controlling the weight against gravity, where concentric is when you are actually exerting the force, moving the weight in the opposite direction of gravity. Now, there are special circumstances where this rule may not entirely apply, such as slow reps or isometric holds. The rules are going to have to be different in those cases. You can't only have one inhalation and expect not to go through multiple breath cycles during slow eccentrics. It's just it wouldn't be safe, and it's not really practical. For the sake of this video, for the sake of this channel, we're going to keep things pretty simple. With your normal rate of exercise, your normal weight of reps during resistance training, or opening a jar of pickles or whatever it may be, you're going to want to breathe in, inhalation during the eccentric, exhalation during the concentric. I hope this made sense. I hope you enjoyed the video. I hope you learned something. If you have any questions or want any further discussion on this, please feel free to leave a comment. Other than that, thanks for watching, and I'll see you next time.